We begin tonight with urgent developments in security, as the United Kingdom has pledged an additional £31 million, or $31 million, to bolster protection for Jewish communities following a recent stabbing attack in North London. Security Minister Dan Jarvis confirmed the government is accelerating both funding and legislation aimed at countering security threats, signaling a major push to strengthen protections after the incident in Golders Green. We look at how this significant financial commitment will reshape security measures across the nation.
Stop using your finger for notes, sketches, and edits. This Jam Jake stylus pen gives your iPad a smoother, more precise writing feel with palm rejection so your hand can rest naturally on the screen. It charges fast, works for hours, and comes with replacement tips. Perfect for school, work, or creative projects. Check the link in the comments to grab it on Amazon.
Next up, we dive into the healthcare revolution, as Photon has successfully raised a $16 million Series A round to give patients complete control over their prescriptions and bring much-needed transparency to the pharmacy system. Led by Healthier Capital, this funding will fuel the expansion of their engineering and commercial teams, accelerating their mission to become the default infrastructure for modern prescribing and medication access. Find out how Photon is using artificial intelligence to solve deep-seated problems in the prescription experience. In sobering news from rural America, we examine the closure of the dialysis unit at Chadron Hospital, despite the state committing $219 million in rural health funding. John Rieners, CEO of the independent hospital, wrestled with the decision, highlighting the financial struggles and low reimbursement rates that led to the closure. We explore the larger trend of declining healthcare services in rural areas and the creative solutions being proposed to keep life-sustaining care accessible. And finally, we turn to the world of InsurTech as Counterpart raises $50 million in its Series C funding round to expand its specialty insurance products for small businesses. This capital infusion, led by Valor Equity Partners, will support broader offerings through partnerships with wholesale brokers and enhance their agentic insurance platform. Tune in right now to see how Counterpart is positioning itself as the intelligence layer within the insurance ecosystem. The United Kingdom has announced a significant financial commitment of £25 million, equivalent to $31 million, to enhance security measures for Jewish communities following a recent stabbing attack in North London that authorities have designated as terrorism. Security Minister Dan Jarvis stated that the government will be accelerating both funding allocations and legislative efforts designed to counter security threats, framing the move as a crucial step in strengthening protections following the incident in Golders Green. The attack took place on Tuesday and resulted in serious injuries to two Jewish men, Shilom Rand, 34, and Moshe Shine, 76. Both victims were hospitalized, but have since been reported to be in stable condition. In connection with the incident, police arrested a 45-year-old British man, born in Somalia, on suspicion of attempted murder. The suspect was taken into custody after initial hospital treatment and remains under investigation. The Metropolitan Police have confirmed that the assault is being treated as a terrorist act. Officers are currently conducting searches at a property located in southeast London. Investigators are also actively examining potential links between the suspect and a separate incident that was reported earlier on the same day. Photon has successfully closed a $16 million Series A funding round, led by Healthier Capital, marking a significant investment to accelerate its mission of modernizing the prescription experience and placing patients in control of their medication access. The funding round also included participation from Notation, Flare Capital, and Evidenced. The company addresses a critical friction point in healthcare, the current electronic prescribing system. While electronic prescribing streamlined the process for doctors, it failed to provide patients with essential real-time information, such as pricing, inventory, or convenience, at the moment a prescription is written. This information vacuum leads to downstream inefficiencies, including unnecessary transfers, phone calls, and administrative burdens for patients, pharmacies, and practitioners. Photon is repositioning itself not as a simple fix, but as an end-to-end platform designed to solve this infrastructure problem. The new strategy focuses on integrating transparency directly at the point of prescribing, allowing patients to make informed choices before a prescription is sent. For health systems, the platform transforms the prescription from a mere handoff into a patient engagement touchpoint, providing real-time visibility into fill activity and delivery options. Artificial intelligence is central to Photon's approach, serving as the engine to process complex, fragmented data across pharmacy networks, benefit structures, and formularies in real time, translating this complexity into actionable transparency for patients. CEO Otto Sipe stated that the company is building prescription infrastructure for the AI era, leveraging emerging technologies to empower consumers and push the pharmacy industry toward a more open marketplace. Photon's ambition extends beyond single transactions. The long-term vision is to build systemic infrastructure that eases burdens for providers, reduces pharmacy overhead, and ensures patients are informed participants in their care. The company has a foundation built on deep integrations across pharmacy networks and real-time data, having previously helped millions of patients make better decisions. This new capital infusion is set to expand engineering and commercial teams, deepen marketplace integrations, and scale Photon's role as the default infrastructure for modern prescribing. Noi Dung Kai Tait. Rural Nebraska dialysis unit closes despite state funding. The closure of a rural dialysis unit in Nebraska highlights the deepening crisis in healthcare access for residents in rural America, even as the state receives significant federal funding aimed at rural health. The decision to shutter the service at Chadron Hospital has left numerous patients facing difficult choices regarding life-sustaining treatment. Mark Pieper, a patient living near Hay Springs, Nebraska, recounted his experience, noting that he had to make an early morning commute for dialysis 3 days a week. The service at Chadron Hospital ceased operations at the end of March, forcing him to seek treatment in Scottsbluff, a drive that triples his weekly travel time. The closure is emblematic of a broader trend, where rural populations face higher rates of chronic conditions, but significantly diminished access to care compared to urban areas. Pieper stated that the closure eliminated his only local option, leading to stark realizations about the fragility of rural healthcare infrastructure. The decision to close the unit was made while Nebraska officials celebrated the allocation of $219 million in first-year funding from the Federal Rural Health Transformation Program. However, experts caution that this funding, which allows states to use up to 15% for patient care, is intended to explore creative solutions, not simply prop up existing failing services. John Rieners, CEO of the independent nonprofit Chadron Hospital, cited low reimbursement rates, which resulted in a $1 million annual loss from the dialysis service, as a major factor in the closure. The hospital, designated as a critical access hospital, does not receive increased reimbursement for outpatient dialysis. Medical experts point to systemic challenges, including staffing and funding shortfalls. Nephrologist Mark Unrun noted the sad reality of displaced patients and pointed toward preventative measures as a key solution. Suggestions include implementing teleeducation programs to help rural primary care doctors prevent end-stage renal failure and boosting kidney transplantation rates. Data from the National Institutes of Health indicates that rural residents are more likely to develop end-stage kidney disease and face higher mortality rates. Addressing this requires recruiting staff trained to administer home dialysis and improving access to training facilities. For many, the alternatives are equally challenging. Some patients have moved closer to care, while others endure grueling commutes. Jim Wright and his wife are renting a home near Rapid City to facilitate their dialysis access, incurring significant financial strain. Others face multi-hour drives, illustrating the immense logistical and personal toll of accessing essential medical services. Patients and advocates have appealed to state and federal leaders, urging them to utilize the available funding to sustain vital services. Despite outreach, some residents feel unheard by state and local officials, underscoring the urgent need for tangible solutions to bridge the rural healthcare gap. The situation underscores the disparity in kidney health outcomes across the nation and emphasizes that long-term solutions must focus on prevention, infrastructure development, and innovative delivery models, rather than simply relying on short-term funding injections. U.S. insurtech company Counterpart has successfully closed a $50 million Series C funding round to accelerate the expansion of its specialty insurance products aimed at small businesses. The round was led by Valor Equity Partners, with existing investor Vi Capital also participating, bringing Counterpart's total capital raised to over $106 million. Counterpart operates an agentic insurance platform, which integrates modules for broker services, underwriting, risk mitigation, claims management, coverage, and capacity. The platform has demonstrated significant traction, processing over 250,000 applications and issuing more than 35,000 policies across 5 capacity partners holding A-rated financial strength designations. The new capital infusion will be strategically deployed to broaden specialty product offerings through enhanced partnerships with wholesale brokers, and to launch tailored coverage programs for various small business sectors. Furthermore, the funding will bolster claims and risk management capabilities, including support for its proprietary risk-bearing entity, Counterpart Insurance Company. CEO Tanner Hackett stated that this expansion aims to establish Counterpart as the primary resource for brokers seeking specialty liability coverage, providing them with the necessary data, tools, and insights to act as trusted advisors. Hackett emphasized that the agentic insurance system continuously improves with every submission, policy, and claim. Counterpart is addressing market challenges driven by rising litigation costs and low insurance uptake. This aligns with a 2025 Gallagher survey indicating that fewer than 33% of small businesses carry management and professional liability coverage, while 89% expressed low confidence in their current coverage. Counterpart positions itself as an intelligence layer within the existing insurance ecosystem, collaborating with carriers and brokers rather than attempting to replace them. Separately, the U.S. Equal Employment Opportunity Commission reported significant activity in financial enforcement, recovering $528 million through pre-litigation actions in fiscal year 2025, marking the highest figure in the agency's 60-year history.